Hello，大家好，各位 senior 各位 fellow 同埋各位好好嘅private 其他醫院唔同HA 嘅同事同埋朋友，同埋甚至有啲non-medical 嘅人可能都喺度。咁好多謝Dr. Bill Chan 可以俾呢個機會俾我去 share 翻我嗰個Global Health Leadership 嘅 project 啦。咁我晏少少都可以 share 翻多少少關於點解會有呢個 project 嘅成形。咁呢個都係一個 very ambitious 嘅 topic， 我會盡量以1個鐘嘅時間都盡量 condense 翻個 bigger picture from 個 micro to 個 macro， 因為呢次嘅 fellowship 都俾咗個機會係可以由一個臨床嘅 frontline physician 去到一個policy maker 嘅一個層次去思考翻其實一個 health system 應該點樣去改變同埋改進咯。咁我就冇 conflicts of interest 嘅。咁少少 outline 先啦。咁我哋有個 current landscape 啦，同埋 future vision 啦。咁第一個 point 就係點解 why do we need pediatric health system transformation 啦。咁第二就係個 value science and 嗰個 framework to guide health system 嘅 transformation。咁其實有3個 keywords 就係 longitudinal、vertical 同埋 horizontal integration， 轉頭都會講清楚少少。咁而家個 theory 就講緊一個 life course approach 啦，咩係一個 family journey model 啦。咁呢個都牽涉到 in terms of 呢個 buzzwords 同 pediatric 嘅世界同埋primary care 個喺個 policy making level 大家都講緊 whole person health primary care systems maternal neonatal workforce nursing 咁樣嘅 situation 啦。咁亦都有少少嘅 deep dive 啦 as part of 個 project into the Hong Kong situation， 我哋點樣 integrate 翻 future policy health policy with 個 overall 嘅 greener communities social determinants of health and climate change and sustainability。咁去到 next step 就係個 framework 啦。What are the levers for transformation and the next step？ 我哋點樣去link up 翻個 operational execution with the policy levers of change 咁樣，亦都有少少 sharing on 呢個 fellowship experience 嘅。咁呢個其實NAM 就 National Academy of Medicine 啦。咁呢個 Fellowship in Global Health Leadership， 咁因為呢個係嗰個 origin of 呢個成個 project， 我都係想盡量 link up East West 嘅 experience。咁 NAM 就 US National Academy of Medicine 就其實係 Abraham Lincoln 1863年嗰陣時 found 咗係一個 non-profit 嘅 advisory organisation to 個 US government。咁佢其實 play 一個好 important 嘅 convener role， 即係佢真係會 convene 翻唔同 sector 嘅 expertise in science、engineering and medicine 啦。咁佢哋個 mission都係 improve health outcomes for all globally through international collaboration networks to advance health equity。咁所以佢哋都有個 big project 就係 link up 翻global 嘅 alliance for climate change， 呢個係佢哋最新嘅 project 嘅。咁所以我嗰個 leadership 就好 lucky， 嗰個 global health leadership 就好 luckily part of 呢個 program。咁都係想 build capacity to bridge evidence-based science and policy and future leaders 咯。所以就引發咗呢個所謂嘅 fellowship 同埋呢個 learning experience。咁 this was the project I was part of 啦。咁就係一個啱啱10月份出嘅一個 paper， 就係 Improving Health and Well-being of Children and Youth Through Health System Transformation。咁我嘅 job 咧就係將呢個 framework 學咗，見咗佢哋 consensus making 嘅process， 就帶翻嚟諗一諗喺香港我哋點樣去 implement 翻一個類似不過亦都係 unique to 香港 situation 嘅一個model 咯咁樣。咁呢個就同 Hong Kong U School of Public Health 一齊做嘅嘢啦。咁點解我哋要 urgently transform pediatric health system globally 咧？其實我哋真係要 address 翻 inevitable future challenges 啦。我哋有 aging population 啦，有 increasing healthcare expenditure， 同埋其實全世界個 disease epidemiology population wide 無論細路仔或者大人都係 changing 嘅。我哋多咗好多 metabolic non-communicable disease mental health epidemics 啦。咁細路仔亦都有 increasing recognition of mental health, behavioral health, developmental health disorders 嘅。咁點解 climate change 同 sustainability 其實都非常之重要？咁其實都係 changing disease epidemiology， 譬如話 vector-borne diseases， 以前 Nepal 係冇dengue 嘅，最近呢20年就真係爆發咗啦。所以呢啲 increased risk of mosquito and tick-borne 嘅 disease 已經轉緊。咁我哋亦都咧其實好得意 extreme heat 咧都好多 studies 係 increased risk of preterm 嘅 low birth weight children 啦。咁亦都因為你有啲 global food supply chain interrupt 咗咧，其實係會有好多 maternal and child nutritional deficits。咁你可以想象 vaccine cold chain 又更加難，係有啲 developing countries to maintain 到 in 一個 extreme heat 嘅 situation。亦都有好多 study 其實都睇咗咧，我哋 extreme heat 咧，我哋個 vaccine response 其實 physiologically 係 impair 咗啦。呢個我就將自己嘅 immunology 嘅我哋冇又帶翻上嚟啦，咁樣啦。咁所以同埋時間全世界都係 ongoing challenges of health workforce attrition 啦。咁所以我哋其實真係要改變我哋個 system 啦。咁呢個 life course approach 我所謂嘅 family journey model 咧，其實就講緊好多early life intervention interventions 啦，點樣去 provide 個 opportunity to 真係 transform 翻，唔係淨係 system， 而喺個人嘅層次個 life trajectory for multiple generations to come。咁真係 provide 一個 genuine continuum of care from birth to adulthood for not just 個 patient but actually 個 whole family 咯。咁個 aim 都想嚟考翻啲 lifelong 嘅 health 啦、well-being 啊、economic 啊、humanitarian 同埋 equity 嘅 benefits。咁希望都可以幫每個國家可以 achieve 到呢個 UN 2030年嘅 Sustainable Development Goals 啦。咁而家個 current pediatric health system 咧，其實就冇 address 到個 broader determinants of health in a very integrated approach 啦，所謂嘅 whole person health。咁有好多 structural fragmentation and inefficiencies。咁所以我諗我會 argue 個 first transformation 嘅 step 其實我哋係要 transform 咗我哋自己個 paradigm 同埋嗰個 definition of what is health and whole person health and before 我哋可以有 systematic reform。咁其實一個人no man is an island individual 係處於一個 social and community 嘅 network 入邊。咁呢啲 food security 啦、education, work environment, living and working conditions, basic water and sanitation, housing 其實都係講緊係影響翻成個 ecosystem of health 嘅。咁我哋點樣去 move from 呢個之前我哋話20th century 嘅 survival mindset， 以前我哋話 no child left behind， 其實去到21世紀我哋真係應該諗緊我哋點樣 go from survive to thrive， 可以做到 every child striding forward 咯。咁其實我哋有 increasing rates of chronic and non-communicable disease amongst all age groups 啦。咁喺香港嚟講就係細過15歲其實都有 7% 嘅。咁無論係呢度啦，即係 overweight and obesity 啦、hypocholesterolemia、hypertension、DM 其實都升緊嘅 ，with increased 嘅 doctor consultation and hospitalization rates 啦。咁呢啲都係最新嘅 data， 有啲就啱啱去到可能 COVID 之前，咁其實之後都未再 update 過喺個政府嘅 census 嗰邊。咁 SHS Student Health Service 其實個 rates of overall overweight and obesity喺香港 still rising 啦。咁 up to 25% in primary and secondary school age children， 咁 only 50% of children and adolescents 會自己匯報翻佢係 active 嘅，即係跟翻 WHO 嘅嗰個 definition 啦。咁但同一時間唔係淨係 obesity， 我哋其實知道香港係全部 developed countries 入邊其實係最大嘅 wealth gap 同埋最多嘅 socio-economic disparity。其實有 20% of infants and adolescents and 即係 total 10% of children 其實係 underweight 嘅。咁同埋我哋都有 high rates of hypertension， 所以我哋唔可以 overlook 咗其實係 both ends of the spectrum of our children 其實係有唔同嘅問題。咁 mental health crisis in children and youth 都係 on the rise 啦。咁呢個都 increasing being recognized。咁 as per 最近個都有份子係講緊 suicide rates in youth 其實都係上升緊。咁 Hong Kong Youth 同 CUHA 分別兩個唔同 survey 都係幾驚人，即係 up to almost 20 to 30% of children 係有啲所謂嘅 mental health disorders 或者 suicidal behaviours。咁 concordantly 當然多咗啲 psychiatric 嘅 new case referral 啦。不過 unfortunately 我哋 psychiatric 嘅 service doctors and nurses 都係 on 即係因為有 attrition 其實都係跌緊咯。咁 asthma burden 最新嘅 data 都係去到2016年。咁當然個 higher prevalence 就係 within children 啦，10% of adolescents 啦。咁當然 most of the deaths 就係大過65歲嘅。不過 most of the hospitalization 啦，其實係 children are disproportionately represented in the disease burden， 所以我哋更加應該要注意翻 what are the reasons for this 啦。咁其實香港政府係有個 real time air pollution map， 你都真係可以入翻你邊個地區啊，譬如話呢個係觀塘啦咁樣啦，咁可以 real time 睇到你個我哋個 air quality。咁其實 50% of 我哋個 air pollution 或者 emissions 係 locally emitted 嘅，咁 mainly from vehicles and container ships， 佢哋都有晒啲 sources 嘅。咁 Hong Kong air quality 咧，其實如果你睇文獻上面 literature， 大家最注重就係個 PM 2.5 levels 啦，就 consistently 2 to 3 times above 個 WHO limit。咁呢個都係講緊 long-term exposure 最多 linked with asthma prevalence 同埋emergency rooms admissions 嘅，所以 this is a big reason for 我哋嗰個 asthma 嘅 issue 啦。咁 as we 我哋有一個healthcare expenditure 咧 aging population， 你見我哋個 healthcare expenditure 都 triple 咗啦，即係由2011年去到2021年係不停上升緊啦。咁我哋個 service provision 其實 historically 我哋梗係知有 long waiting times 啦 for both specialist and outpatient。咁最近我哋都多咗 public-private 嘅 partnership 同 subsidy， 其實係channel 咗多咗啲正去 private。譬如話你當以前我哋有90%病人係 public 係睇緊醫生嘅，而家都去跌翻70%啦。咁但係其實個 overall waiting time 咧，因為有 significant 嘅 workforce attrition 同埋 rising demand， 其實都冇短到嘅。咁所以譬如話我哋睇翻waiting time for public service， 其實去到2022年都係仲係 increasing 緊啦。咁個原因亦都係主要都係 healthcare workforce attrition。咁特別係喺 allied health 啦同埋registered nurses 嘅層次。 咁雖然我哋多咗啲 university funded places 啦，多咗 recruit 咗 non-local 嘅醫生同埋姑娘啦，亦都多咗啲legislation 同埋 plan for 第3個 medical school。其實我哋最緊要而家仲係有啲 burnout 啦 ，workforce retention 同埋嗰個issue of 我哋需要多少少 role optimization 嘅in 嗰個healthcare system of the future， 我哋夠唔夠 advanced practice nurse、specialty nurse？ 如果我哋講緊係要 vertical integration 或者 horizontal integration， 其實我哋有冇 coordination nurses， 同埋我哋會唔會 diversify 翻個 role of who is a healthcare worker， 同埋點樣去動用 community 嘅資源去幫我哋咯。咁呢個census 就係2024年1月啦。inpatient care 其實咧，就算你話係 private 睇啦，但係其實 12% 咧 of most people are not covered by insurance at all。所以如果你哋話我哋要 public-private partnership， 其實仲有一橛嘅病人或者係香港人其實係 not covered by insurance 嘅。咁甚至係你話係 OK， 如果係話percent of population covered by insurance， 咁又5成冇啦。咁特別一個 gap 咧就係 dental medicine 啦，淨係 20% of 成個 population 喺香港其實係有 dental medical 嘅 care under insurance 嘅。So 我哋淨係講細路仔啦 ，less than 40% of children are covered by private insurance, although we have the second highest rate of admissions after the elderly. So if 我哋話又係講 partnership 嘅 issue， 有個 structural problem there 嘅。咁呢就係香港嘅最新嘅嗰啲 data 啦。咁咩係一個 life course approach， 同埋咩係 longitudinal, vertical and horizontal integration 啦。咁我哋其實如果頭先話要 innovation， 其實 innovation 大家會成日諗啲好 high tech 嘅嘢啊。咁其實我哋要由最基本個 definition 為其實都要 innovate 咗先，我哋先可以去到個下流個 action 啦。咁其實我哋個 definition of health 以前我哋就 absence of disease 啦。The future definition 其實就真係講 whole health, physical, behavioral, spiritual, socio-economic well-being。咁以前個 goal 就係 maintain and prolong life 啦。Future goals 咧，如果我哋一個 community and family 真係我哋會 focus 翻 on intergenerational health 啦 ，improve lifelong health and well-being trajectories into adulthood, socio-economic, societal equity 同埋 humanitarian benefits of 個 system。咁而家都講緊係population health and planetary health 呢樣嘢，not just 話我哋 healthy communities， 但係真係講緊 sustainable green communities which build a better planet and also sustainable future。咁個 target client 係 individuals， 永後就真係要諗多少少 individuals 啦 ，population, families and communities。咁都 moving from 一個 biomedical model to 一個 life course and socio-ecological model，and also from a siloed independent delivery model towards 一個 vertically, horizontally and longitudinally integrated 嘅。我哋啲 interventions 應該係要 move from reactive to proactive and preventive 啦，咁 from diagnosis and treatment 同埋 rehab 去翻真係 lifelong and universal health screening 啦 ，preventive care 啦 ，health promotion, production and optimization。咁個 time frame 要 from short and episodic 去翻 lifelong and continuous。咁 systems outcome 其實我哋 classically 真係講緊 productivity 同埋 performance outcome 即係number of bed days 啊 ，hospital beds 啊嗰個數目字，但係其實有啲嘢 if 我哋真係要好認真去 invest in longitudinal outcomes，其實你係未必 measure 到嗰個 cost-benefit analysis， 有啲 value-based outcomes 其實某啲國家都係 shift 緊 to 嗰樣嘢 rather than 真係performance-based 嘅嗰個cost-effective analysis 啦。咁亦都係 best practice 應該有 embed 埋 sustainability and equity in 我哋個 prerequisites for 我哋個 design 啦。咁呢個 whole person health model 其實都係有個 big overlap between pediatrics 同埋 family medicine， 因為我哋其實係嗰個 first touch to 個 community 嘅，咁都係希望我哋話 whole health care from occupational health, emotional health, environmental health 啦，可以有個 team-based approach to really align with 一個每個人嘅 life mission, aspiration and purpose。所以其實去到某一個層次，雖然我哋講緊 policy for population health， 呢個其實都係有某一個層次某一款嘅 precision medicine， 因為我哋真係想 individualize 嗰個health outcomes to 嗰個 individual 嘅 human beings 嘅需要同埋 potential 咯。Socio-ecological model of health 呢個就係 Bronfenbrenner's ecological system。咁一樣我哋其實講緊都係同一樣嘢 child health， 我哋點樣去 classify 翻或者歸納於唔同 systems 嘅啫。咁呢個就 micro、macro、exo、macro 同埋個 chrono system， 咁都係講緊 individual、interpersonal、organizational 同埋個 public policy， 再加埋個 chrono system 就係個 longitudinal factor of time。咁一個 life course journey model 咧，其實都係 focus 翻 on opportunistic family-centered approach 啦 ，to screening, support and intervention。咁其實一個人係有 preconception, prenatal, birth, childhood, adolescence， 我哋好多 key windows of transition of change 嘅。咁特別係 along 嗰個 early childhood development 同埋 adolescence to adulthood。咁啲 cost utility analysis 都 quite promising to evaluate 個 spillover effect。當我哋 integrate 晒全部呢啲 maternal, fetal and child health outcomes 嘅時候咧，其實個 outcome outcome 都係worthwhile 嘅。咁當然 higher level evidence is still needed 啦，因為有啲 integration methods 都未必好 standardized 或者 measurable。咁 what do we mean by integration？ 呢個都係 Royal College of Pediatrics 喺 UK 嗰邊都係講2040年我哋個 goal。其實而家大家都喺 policy making 都好 hot 用緊呢啲字係 horizontal integration 就係 across sectors and childcare providers， schools, community, social welfare, housing, nutrition, tech, design。咁 vertical integration 其實就講緊 across tiers of healthcare sectors 啦 ，from community, primary, secondary, tertiary, quaternary 啦。咁 longitudinal integration 就 add 咗個 element of time， 咁呢個 vector 就係 over 成個 family 嘅 life journey 啦。咁我哋真係想bundle care 啦，就諗緊 from early life intervention。咁 families 我哋而家就用緊個字眼就 co-creators of care， 我哋一齊 create 嗰個 care for 呢個 family。咁有 systematic screening at key developmental phase， 咁盡量想同一時間 address 翻 health, social and mental needs， 同埋 take 個 opportunity to 有啲 opportunistic 嘅 health promotion and education。咁當然就係 through 呢啲 vertically and horizontally integrated systems 啦。咁都係講緊as an example of horizontal integration 就係 through all of these community、family networks, workplace, social environment 其實都係想做好呢件事啦。咁maternal health, perinatal child health 都想特別 highlight 埋，因為而家個 system 雖然我哋有 emphasize 翻 antenatal care 咧，不過就喺 preconception, postpartum and interpregnancy stage 未必係好 integrated with 啲 well woman health 嘅。咁我哋都知 maternal obesity and undernutrition does increase the risk of pregnancy 啦，嘅 complication SGA, LGA and metabolic and behavioral disorders in children， 同埋 1 in 10 women really have depression pre, during and post pregnancy 啦。咁 healthy early life moments in Singapore 咧，其實Singapore KK Women's and Children's 有一個都幾interesting 嘅同埋working well 嘅 model 咧，佢哋會 proactively recruit 咗啲 planning to conceive 嘅 women 啦，咁就有好多 coordinated interventions at preconception, pregnancy to postpartum， 同埋 peri-pregnancy 同埋 inter-pregnancy period。咁佢哋有個好 innovative 嘅一個 mobile, digitalized, personalized, interactive health platform 啦，都 to promote virtuous cycles of health for long-term maternal child health。咁佢哋有呢個就叫 golden thread approach，healthy early lives 就係想由 vicious 嘅 cycle 轉一個 virtuous 嘅 cycle of health， 咁由 downstream 去翻 upstream 啦 ，unplanned to optimize 啦 ，passive to active 啦 ，synchronized 同埋 cross-sectional life cross approach。咁所以佢哋就會有 define 咗每一個 stage 有啲咩 for mother、child， 再加埋 early child intervention 同埋啲 early child 嘅 support financial mental health 嗰啲就一次過加埋一齊啦。咁呢個都幾好嘅。咁 early childhood years 其實我哋都知道係一個 gap 啦，即係喺呢個 school readiness 嘅 period， 其實physical well-being and motor delay social emotional development 入學之前其實都會有啲嘢係可能都容易會 miss 咗嘅。咁呢個都 having a look at 嗰個 public 嘅 pediatric healthcare services， 咁 as of May 2024年係最新嘅 at least published 嘅所謂嘅 data 或者啲 number 啦。咁我哋有 DH 啦，我哋有 MCHC 啦 ，school health service 啦 ，school oral health 啦，outreach immunization 同埋我哋有 CAC 啦。primary healthcare 就係我哋個 GOPC 同埋而家18區都有翻啲 district health centres 啦。secondary and tertiary healthcare 我哋每間嘅大嗰啲醫院啦 ，regional hospital 啦，咁有兒童醫院 as quaternary care 嘅。咁點樣去 integrate 翻？同埋我哋其實我哋做緊啲咩，同埋有啲咩可以做得再好啲。咁 MCAC 就係有94% of locally born babies， 咁 childhood vaccination up to 5， 咁都幾 comprehensive 嘅 care 嘅，咁佢哋可以 refer 翻 second tier。咁 future consideration， 譬如話 compared to 新加坡個 model， 其實 at this time point， 人哋個 model 可能會有啲 financial support， 有個 one-off bundle at birth to cover the cost of initial child care 啦，會有啲 interpregnancy 嘅 health 啦，maternal women's health clinic 又會做翻啦，咁同埋有個 gap 就係我哋香港的確係冇 preschool 嘅 vision screening， 呢個係要 focus 翻嘅。咁 CAC 咧就當然就我哋 recognize 越嚟越多啲 behavioral 或 child health 嘅嗰啲所謂嘅 issue。咁其實我哋真係要 increase 個 scope and scale of the services， 因為而家條隊都長嘅，同埋睇下我哋點樣去 strengthen 翻一個 hub and scope 嘅 integrated care pathway between 嗰啲 centres 同埋個 community， 呢個我哋都需要做。咁 child immunization program 其實都有 95% coverage， 咁同埋有 mobile vaccination for secondary students。咁 for future consideration， 譬如話澳洲都 introduce 咗 universal HPV vaccine for boys。咁 from 一個 public health level， 其實呢個值唔值得諗呢？咁 school health service 係當然係冇唔係 school based 啦，但係都會 freely transport students to participate。咁個 coverage 都好好，咁佢哋又會真係會睇翻 growth、health vision、hearing、scoliosis、puberty。咁我哋會唔會同一時間趁個機會去 include 埋mental health assessment, behavioral health assessment 或者 early intervention for special needs 呢？ 咁 school oral health service 咧，其實98% of primary school children 係有 participate 嘅。咁但係個 issue 咧係 under 15， 即係去到 adolescent age 咧，得44% 係 covered by 個 public。咁 as we know， 我哋之前嗰張 slide 都有講咗，74% of dental care is accessed in private， 但係得20% 係 covered by insurance。所以喺個 dental care 嗰邊，我哋真係會需要諗一諗，有冇啲 co-care 嘅 pilot schemes for partial subsidies 啊嗰啲咁樣咯。咁呢個都係頭先講翻嗰個dental issue 啦。咁其實 preschool based 嘅 birth weight 或者 body height measurement and growth chart plotting， 我哋有啲新嘅 guideline 就想 incorporate 埋啲 physical activity 喺 kindergartens and childcare centres。咁其實呢個都幾好，有個 framework 係可以俾翻 school policy 同埋 feedback model， 有 parental involvement， 就係其實 train 翻啲 teaching staff 做翻好最基本嘅 body weight、body height measurement 同埋 growth。咁有翻一個 smooth 嘅 referral pathway to primary care physicians。其實呢個就係我哋話 role diversification 同埋 optimization。其實 non-medical 嘅人都可以做到一個喺 community 層次入邊都會幫到我哋細路仔嘅嘢同埋 monitoring 咯。咁 school-based service WHO 其實有個叫 health promoting school 嘅一個 framework 啦，咁其實都係啱啱係講緊係 for healthy eating 嘅 basis 啦，但係亦都 incorporate 咗啲所謂嘅 mental health 嘅 aspect。咁有啲 adolescent health outreach program with school student health service 都而家啱啱都 build 緊嘅。咁其實 school meals 都係一樣嘢，你話 nutrition healthy school， 咁其實日本真係會提供 2 full meals per day。咁我哋有咁多 underweight 同埋 obese 嘅 children， 其實 would this be a healthy model to think about introducing 呢？咁個 cost 又會點樣？大家可以諗一諗。咁所以 school-based mental health support 咧，咁你當有 3 tiers 啦，一個就係 universal promotion， 大家都應該有一個 awareness of mental health， 同埋我哋點樣去有 mindfulness 啊，去 handle stress 啊 ，coping 啊，喺 key transition stages of life， 同埋有啲 mental health needs 嘅 students 又點樣去 enhance 翻個 support 咯。咁所以呢個 student mental health support scheme 就有90間學校去到210間啦。咁我相信 Education Bureau、Social Welfare 同埋 HA Specialist Psychiatry 都會繼續 if possible 會想 expand 嘅。咁呢個就一個 example of 一個所謂嘅 cross sector 嘅 horizontal integration 啦。咁 primary care 我哋當然有我哋個 DHC 啦，我哋有好多 family care physicians 啦。咁其實個 planning 咧都係而家 within 而家現有嘅 structure and framework 都係用緊個 word of horizontal integration with vertical integration to secondary and tertiary service。咁其實我哋點樣去 make sure 呢個係 bi-directional， 有冇 role for telehealth 啊 share care consultation to build workforce capacity both ways 啦。parenting support 又點樣去 optimize 翻 care coordination mental health integration， 同埋始終咁如果 primary care pick up 咗，咁佢哋有冇辦法可以 refer 翻俾 DH for development and immunization？ 咁呢個我哋就可能要再 consolidate 多少少啦。咁仲有啲咩 horizontal bundling 嘅 possibility 咧？咁我哋都知 long-term DH under primary care 係會 merge 咗嘅。咁但係我諗呢個 bi-directional referral from social welfare department 都重要。譬如話有啲人係住開劏房嘅 subdivided units， 其實佢會唔會已經有一個辦法係社工可以 refer 翻俾 primary care physician for nutrition 啊 growth well-being and development 啦。我哋知 preschool vision screening 係一個 gap 啦。我哋可以諗一諗，即係 adolescent 嘅嗰啲 well women's education and care 會唔會 integrate 翻 with women's health centre 啦。咁如果我哋真係想 strengthen 翻個 public-private partnerships， 其實有50%嘅香港人係 no coverage at all by insurance。咁我哋要諗一諗點樣 extend 翻現有 adult 嘅嗰啲 chronic disease co-care schemes for children with the same issues 啦。咁同埋有啲 dental care subsidies， 特別係 adolescents 係得 44% covered by student health service， 要再諗一諗啦。咁其實而家都有啲 financial support 係 bundling， 就係個 working family allowance 同埋個 school textbook assistance。不過咧係得12歲以上先有，所以我哋又要諗一諗有冇辦法可以 extend to under 12啦，同埋啲 ethnic minorities 同埋 special needs 嘅 allowance 其實係咪真係夠啦？咁 specialty tertiary and quaternary care 咁其實都有唔同 HA 嘅醫院都 provide 緊呢啲 service， 特別係 emergency 啊同埋 community care 啦。咁喺 CH 其實兒童醫院我哋都做緊啲 complex and common disorders 啦 for multidisciplinary care， 同埋係一個 centre for stem cell transplant 同埋 future 個 cellular therapy。咁其實好重要嘅工作就係大家進行緊嘅，而家都係 licensing of the new precision therapeutics drugs and medical services。咁呢個喺香港嘅 policy address 2024年CE 都有 HC 都有康康師都有特別提到嘅，因為個原因係我哋要新嘅藥，咁都係要過咗嗰個註冊嘅過程。咁其實一隻藥有註冊去到真係可以去到攞到成分嘅funding，係真係要搞成有時真係要好耐。而家我哋都 expedite 咗個新嘅 framework， 啱啱呢一輪5月份啱啱行咗一輪都快咗好多。 咁亦都係 newborn screening 啦，要 consolidate 啦 ，good treatment pathway for precision medicine， 同埋有個 registry of rare and common disorders。但係最緊要我諗都係 bidirectional care in terms of 一個 vertical and horizontal integration， 真係 across all the sectors 要容易 communicate， 同埋有個 collaboration 同埋 co-funding for integrated programs specifically。咁bridge funding sources 其實我覺得呢個係個 very good time point。當我哋諗緊我哋要 transform 嘅 health system， 其實precision health 同 population health 唔係 mutually exclusive， 其實佢哋係可以 converge 翻喺一個 point 就係 individualized healthcare at prevention and treatment at all stages of life and starting with the point of newborn screening and lifelong screening onwards。其實 it's a very good opportunity to 將啲 funding sources to converge 翻，因為我哋啲 outcomes 其實係 lifelong course 嘅 health improvement 嘅。咁當然 socio-economic factors education 同埋 HA hospitalization 都有關係啦。咁其實我哋得1/3嘅 population is economically active， 有60%嘅 population 其實係 economically inactive 嘅。咁 lowest median monthly household income 都係 associated with highest rates of hospitalization。但係 income 咁大家都知即係 education 都好重要，但係其實 only 35% 咧 of 我哋嗰啲畢業嘅中學生咧係會去到 post-secondary education，which is very very low for 一個 developed country of 我哋嗰個 wealth disparity gap。e-health 咁當然我哋都有個 plan to electronize 翻全部啲 health records 啦 ，which integrates multiple functions of data sharing, service support and consolidate longitudinal records。咁我哋都希望大家可以用翻一個 system。咁呢個就係你當我哋而家有嘅嗰個而家個 system 啦。咁其實我哋如果當一個 checkpoint healthcare reform， 咁都係用翻我哋 Chief Executive 2024年 October 嘅 policy address， 都係啱啱呢幾個月前講嘅嘢。咁我哋係咪 hitting 我哋需要去到嘅 points？ 咁其實都 OK 嘅，因為其實我哋呢個 policy just 都提到頭先講嘅嗰啲 keywords 啦，health promotion 啦，佢哋都用到 life course framework 啦 ，repositioning of maternal and child health and family planning services 啦 ，integrate 埋啲 women health service 同埋 elderly health centres 啦，有 community pharmacy program 啦 ，strengthen 翻 whole school health program 啦，同埋個 3-tier 嘅 mental health program 啦，有個 mental health literacy package， 同埋佢哋都有提到嗰個 primary dental co-care pilot scheme for adolescents。所以頭先提嘅嗰啲 gaps 其實係個 policy address， 最緊要就有個 policy commitment， 我哋就可以行到第一個 step 啦。咁 what is the way forward to bridge 翻 past, present and future 啦？咁而家就講翻真係 medical 個層次，我哋點樣去 achieve 到 precision medicine 啦？咁 newborn screening to life course screening，how do we intersect population health and precision health？ 同埋最緊要我哋話 innovation 啦。咁 if innovation 係一個 strategy， 咁我哋點樣唔 worsen existing 嘅 health inequities？ 因為有任何新嘅嘢，譬如話 AI 或者 new technologies， 其實都係會要諗一諗個 accessibility 嘅問題。我哋點樣去 make sure 我哋係真係 every child striding forward 而 not some 咯。咁我諗 newborn screening 呢個就唔特別長講啦，不過大家都知道即係嗰個 diagnostic odyssey 喺香港咁 so far 你話NBS 嘅 IEM 嘅 pilot 就2015年開始，咁去到 NBS 結就 severe combined immune deficiency， 咁我都好榮幸係 part of 嗰個 frontline implementation from July 2022年到而家，咁就 territory wide 啦，咁就再加埋而家我哋2023年就加埋嗰個 SMA 嗰個framework 就 piggyback 咗 on top of 呢樣嘢，咁所以我哋一個 punch 就做晒3樣嘢 with 一個 new technology， 咁而家個 callback rate 都少咗好多，亦都精準咗好多嘅。咁我哋點樣 maximize 翻呢個 utility？ 我哋話 newborn screening， 咁雖然係你話其實uncommon disease 真係唔係咁 uncommon， 因為 newborn screening 嘅時候我哋都發現咗，其實都 pick up 咗好多 unexpected incidental 或者之前真係會 miss 咗嘅嗰啲 condition 啦。咁當然我哋要 make sure 我哋個 public health NBS program 係 100% coverage 啦。當然而家今年亦都好彩的，我哋都係有個 pledge 係會 extend to 個 private sector， 其實今個月差唔多都開始㗎啦。咁但係 screening is just the beginning 啦。我哋除咗你話 precision， 我 pick up 咗 diagnosis 一樣嘢，但係其實我哋都要 optimize 翻個 integrated care pathways 啦 ，availability 啦。integrated multidisciplinary care 啦，特別係譬如話 OK， 雖然 for example 啦 for severe combined immune deficiency， 而家我哋多咗啲 haplo-identical donors， 但係其實係個 global bone marrow donor registry， 其實大家都應該要 register 翻，因為有啲match unrelated donor 都係個 option 嘅喎。其實我哋要更加 partner 翻 with 我哋個 Hong Kong Red Cross， 特別係你話香港嘅 blood bank 永遠都係唔夠血嘅，咁所以其實有啲 non-conventional 嘅 health partner， 其實我哋都要 strengthen 翻呢啲 relationship 嘅。 咁 newborn screening planning 咁就好多 challenges ahead for service delivery coverage reducing fact precision 呢個我就唔特別太講，因為今日唔係個 focus of 個 talk。不過我都想 introduce 翻，其實而家最新喺 UK 同 US 大家都係講緊點樣用 NGS 或者 whole genome 去做翻個 newborn screening 啦。呢個就講緊係好多 ethical issues 啦 ，downstream care。咁大家都知 whole genome 係會製造咗可能有啲 VUS 嗰啲 which is 冇 clear cut 嘅所謂嘅 strategy 嘅。咁所以呢個都係下一步啦。除咗你話我哋 screen 嘅3個 condition 之外，咁會唔會 one day 我哋係會用 whole genome 咧？咁當然佢入邊有包含咗好多啲 ethical issue 同埋啲 downstream care 嘅 issue 啦。Working towards precision medicine 咁一個 ideal 嘅 pathway 就係你當OK 我有啲 novel 嘅 basic translational 嘅 research 啦，有啲 genetic and molecular pathways 啦，去到間醫院我有啲 multidisciplinary standardized 嘅 scoring 啦，咁我有啲 real time data collection， 可能有啲 disease biomarkers 啦，有 imaging 可以 prognosticate 嗰個病個 severity 或者嗰個likely 嘅嗰個 long term outcome 啦，咁可能我哋會有啲 novel understanding， 有 correlate 埋 immunogenetics the disease classification 咁又可以 design翻一個 personalized and precision 嘅 treatment strategy with treat to target pathways for the most effective use of, for example, for 風濕科就 biological agents 咯。咁最後都想 improve 翻個 patient function and quality of life。咁我相信呢個都係一個所謂嘅 integrated model。我哋喺新嘅世紀入邊，即係除咗你話 novel therapies 嗰個 model of care，我哋點樣 integrate 翻 research and education at 個 point of care of service delivery 都係一個好重要嘅諗法啦。咁我哋其實仲有咩 action 係要 take now to bridge 嗰個 past and present 啦？其實我哋要 diversify 翻我哋個 workforce 啦，喺嗰個 training 上面，我哋永後就唔可以淨係話 healthcare practitioner， 其實我哋可能會要做 practitioner researcher， 我哋或者 practitioner policy maker。咁大家都可能真係走唔甩，都有啲 genetics and bioinformatics training to 真係有翻一個 unique perspective from 嗰個 micro of 個 molecular pathway all the way to 個 macro of 個 phenotype 同埋個 overall disease control。咁其實而家我哋特別係用緊 whole genome 嘅時候，我哋就或者 whole exome 特別就真係知道有啲 complex cases 可能真係有啲 monogenic 嘅 pathogenic genes， 咁呢個都幾重要，因為我哋可以真係 target 翻 specific therapies， 有啲 cellular therapies 會唔會有 gene therapy for further service 嘅 planning 啦，同埋當然我哋需要即係繼續 develop 翻我哋嗰啲 integrated pathways and programs， 同埋其實 health system 咧就要 resilient， 咁我哋喺呢個financing delivery workforce 同埋 climate resilience 又點樣 harness 翻big data AI telemedicine with 一個好 equitable 同埋 ethical 嘅一個 approach。咁我哋就希望frontline needs 都可以 drive 翻 individualized patient care from 一個 policy making level 啦。咁所以最後我哋都要 bi-directional lessons， 其實都幾得意。population and precision health 其實真係 two sides of the same coin。喺 population level 我哋會有好多啲 epigenetic interactions，climate change 點樣影響啲 individual omics microbiomics 咁 population level 嘅嘢都可以 inform 翻 individual phenotype 嘅。咁所以其實 from population genomics to individual genomics 我哋真係有個 bi-directional lesson 咯。咁 in this sense 嗰個 vertical and horizontal communication data collection would be very important。咁 Sick Toronto 有個好嘅一個slogan 就係 from genetic code to postal code diagnose faster, treat smarter and predict better。Innovative tech and AI 其實有個 question 就係咪一個 boon 或一個 burden 啦，咁都幾 controversial 嘅，因為最近喺 Seattle Children's 都開咗個 Pediatrics 嘅 Bioethics Conference。咁而家我哋有咩層次係已經用緊 AI 咧？咁其實有啲 interactive 啦 ，innovative digitalization 啦 of healthcare diagnostics and platform delivery。譬如話你有啲 predictive analysis by AI algorithms， 譬如話喺個 whole genome genotypic phenotypic algorithms， 其實我哋而家都用緊啦，即係睇可唔可以 pick up something in the 鬧大海一支針嘅時候，會唔會可以咁樣去用 AI 揾得到多少少嘢，或者 biomarker prognostication、big data 其實佢哋都會用啦已經。咁 in-hospital digital platforms 啦，to synchronize interaction and care，個 parent 喺 office 佢點樣用翻一個 digital platform to interact with 個 medical team， 同埋譬如話 order 翻啲 non-medical 嘅嗰啲 equipment食物嗰啲咁樣啦。咁就同一時間有啲 multilingual 嘅 digital tools 啦 for ethnic minority groups 啦。Chatbots 其實喺 US 某啲 hospital 都用緊 to summarize 翻 clinical notes discharge notes translate 翻 consent forms 甚至係有啲 mental health therapy to teens 呢個當然 very controversial 啦，呢個亦都 not vetted by FDA。咁 the issue with AI 就係 children is a bioethical challenge。其實我哋點樣去 define 個 function of AI 同埋 make sure 我哋個 design 係 in accordance。咁 extrapolating health data from adults 已經好困難咧，因為細路仔同大人根本都唔同。咁喺個細路仔嘅層次patient physician relationship 都幾多 consent issue。咁 AI 係咪會變咗一個 fourth partner in 呢個 triad of 呢個 relationship？ 定係其實 it's just another tool， 咁所以我哋要小心我哋點樣去用 AI 啦，同埋我哋點樣去 design for that purpose。咁 if 個 algorithms 其實都會 perpetuate existing 嘅，譬如話 racial 啦、socio-economic bias， 咁 who is accountable， 同埋喺legal governance 嗰邊係未 standardized practice 嘅。咁呢個就係頭先嗰句就講緊 medical precision 啦，或者 future technology 啦，咁就講緊 innovation。咁就去到我哋個 policy address 都想 touch base 翻喺香港嘅層次，其實我哋做咗啲咩咧？咁我都 go through 咗 Chief Executive 嘅 policy address， 頭先就講緊 social determinants of health 啦 ，beyond healthcare 我哋諗緊 horizontal integration， 咁我都幾長嘅，我都讀晒。咁我就 pull out 咗少少啲 key points 啦。咁 poverty alleviation 我哋真係 23.6% of 我哋個 population 係 under 個 poverty line 啦，咁全部 develop countries 嚟講，我哋係 greatest wealth disparity 嘅。咁 social welfare 其實 is the top of public expenditure 啦 ，more than 300 million spent on social welfare per day。咁呢個夠唔夠啦？咁大家可以再諗一諗。咁 schools child health support 咁政府有pledge to 話 increase 翻啲 daycare service 啦，但係呢啲 number 就唔係好多。housing 就話support young people for 個 housing ballots 啦，咁但係就會唔會足夠咧？咁 education 就話多咗啲 support for 啲 ethnic minorities 啦。labour 就係話我哋會 review 翻會唔會 implement 翻一個statutory 嘅 minimum wage，which is 我哋而家係冇嘅。咁我哋真係有 increasing social welfare expenditure 啦 ，with 個GBA 嘅大灣區啦。咁其實呢度大家都見到。2019至2024年就不停係增加緊嘅，即係無論係 CSSA、DA 同埋特別係多人係move 咗 to 廣東同埋福建咁樣，咁所以都有一個 big population outside of Hong Kong，which is 係攞緊 social welfare。不過同一時間佢個 healthcare 又未必一定會喺香港嘅喎，咁所以呢個 changing dynamics would be quite interesting。咁 greener hospitals、greener communities、greener cities， 我哋點樣有 more equitable and inclusive societies， 同埋我哋點樣 embed 翻 equity into 個 system design 啦 ，to achieve sustainability through innovation and overall， 我哋其實想大家healthy lifestyle 都係講緊想 promote 翻一個 low carbon and green lifestyle 嘅。咁 greener cities 喺 waste and recycling 嗰邊，咁我諗呢幾年大家都會多咗好多啲 waste and recycling hubs 喺學校同埋 community 入邊啦。咁我哋個政府嘅 aim 就係 aim zero landfill zero emissions by 2050年，咁同埋有啲 legislative 嘅嗰啲 framework。咁我諗大家都知道，即係喺嗰個 R&D 嘅 product 啊，啲 legislation 啊 ，cleaner production partnership program， 喺我哋嗰個 EV charging 嘅嗰個層次，或者我哋個 greener 嘅 transport system。咁其實政府都有做咗嘢嘅。咁其實 if 你話呢個就啱啱今年1月份啦，咁個 census 我哋睇個 greenhouse gas emissions 喺香港2017年至2022年啦，咁係真係跌咗嘅，即係 PM 2.5 同埋 PM 20同埋嗰個nitrogen oxide air pollutants 其實全部都係 on the downward trend 啦而家。咁 recyclables 其實都多咗嘅。咁 embedding sustainability into community education 啦，咁其實 ecological conservation 我哋如果諗一個 holistic city design， 亦都諗緊細路仔啊 education 啊 sustainability， 我哋真係應該要加埋喺一齊 to make sure 我哋可以from 一個 very young age build 呢個 sense of community partnerships with 我哋嗰啲 ecological conservation。譬如話我哋話 Northern Metropolis 呢個都係 Kaduri 同埋 Croucher Foundation 都整咗一個 maps 啦，就係 map 翻喂全部啲 wetlands 喺邊度啊，我哋點樣去避免我哋會 encroach 咗喺啲 natural habitats， 咁都想 make sure 有啲 NGO partnerships with 我哋嗰啲 policy makers to make sure 我哋可以做好呢樣嘢啦。咁 harbourfront promenades 其實呢幾年都多咗好多啲 green space 啦，waterfront space for exercise 啦。咁我覺得其實幾得意，香港我哋應該 capitalize 翻我哋啱啱今年嘅 Olympics 真係多咗2個金牌，係 fencing 我哋 Siobhan 我哋嘅 swimmer， 我哋其實香港第一個 NBA 嘅 player 終於成嗰日draft 咗，亦都係而家係 play 緊嘅。咁同埋啲 Paralympics 嘅 success， 我哋應該係趁呢個 momentum 去 promote 翻多少少 physical activity 同埋 exercise 咯。咁其實 HA 都有個 carbon neutrality 嘅 commitment 嘅，咁都係 building greener hospitals。咁我唔知大家知唔知，其實 CH 都係一個 energy efficient building， 都嗰陣時贏過獎嘅。咁嗱啦數其實都有個香港第一個話 combine cooling heating 啦 power generating system since 2016年啦。咁其實都會有好多energy 就會 save 咗。咁一個 big emission 喺醫院嘅層次就係 cutting anesthetic greenhouse gas 啦 ，NO makes 50% of 我哋個 hospital emissions 啦。咁其實譬如話 NHS 都有個 net carbon zero 咁樣嘅 pledge， 佢哋都睇緊喺 health research 同埋 health delivery 點樣去 cut 翻我哋嘅 carbon emissions， 同埋點樣喺 HA 嘅層次會唔會有啲 sustainability innovation， 其實 solar panels 啦，特別嘅 aircon handling 啦 ，food waste collection 其實都有啲 new design 都幾得意嘅。咁最緊要當然係我哋 未有 within 個 system 入邊嘅 change 嘅時候 transformation 都 rely on 啲 philanthropy partnerships with NGOs 啦，有翻啲 novel platform delivery and design 啦。咁譬如話 Hong Kong Institute of Philanthropy 咧，其實今年呢個就係我哋嘅 former dean Dr. Gabriel Leung 啦，咁所以其實 Professor Leung 啦，咁所以其實佢都喺同Jockey Club commit 咗一個 3-year 嘅 Climate and Health Observatory Accelerator Project with 一個 global network，just to focus on evidence-based driven policy to translate theory to action， 都有個 fellowship program。咁所以呢個都顯示到其實喺 philanthropy 嘅層次，佢哋都會重視翻 health 同埋所謂嘅 climate 嗰個 interaction 啦。咁 putting it all together, how can we have a transformation framework 啦？咁我哋真係要個 transformative consensus 啦。咁 first 我哋要有個 why 啦，我哋 why we need to change the logic, values and time scale underpinning our rationale for healthcare financing and organization 啦。咁 where 啦 ，where the determinants of health underserved by current services， 我哋個 screening intervention should be provided where 啦。Health service co-creators and providers 應該係邊個啦？我哋點樣 diversify 同 optimize 呢一班人啦？咁 when should the screening interventions be provided 啦，同埋 how comprehensive healthcare delivery should be organized within 我哋個 wider 嘅 health ecosystems 啦。咁 next steps if 你話想要啲 levers of transformation 嘅 framework， 我哋又要個 inclusive 嘅 stakeholder consensus engagement 啦，我哋要 map 翻我哋而家同埋 future needs to evidence-based solutions 啦，我哋要 define 翻咩係我哋個 health outcome， 咩係 system outcome， 咁 system outcome 其實都包括埋譬如話 interoperability 啦、resilience 啦、flexibility 啦，咁我哋亦都要 create 翻一個 health outcomes and system performance 嘅 framework to link outcomes with measurable indicators， 同埋需要一個5, 10, 15 short, medium, long-term strategy。咁 co-creation of effective strategies for integration 就真係要 provide 翻一個 true continuum of across a child's life 啦。我哋要 align 翻 fiscal reform 同埋 streamline 翻 public-private philanthropic funding to reallocate for integrated care 啦。咁亦都要 launch 翻一個innovative and integrated 嘅 digital national health information delivery and data system to support 呢個 transform 嘅 health system， 同埋始終我哋需要 workforce 同埋 technological innovation。咁 not to go into too much detail 啦 but for example outcomes， 咁其實我哋會唔會 prioritize 翻 patient experience 同埋 workforce experience， 特別係當我哋講緊係有啲workforce attrition 嘅時候。咁 as 一個 5-year strategy 咧，我哋有 horizontal milestone 啦、integrated care 啦、population management 啦、reimbursement 啦，呢一堆啦。咁就 early child education、health、family support、welfare， 其實我哋真係需要翻一個 cross sector 嘅 linkage， 特別 for systems building and integration strategies。我哋有啲 common agenda 啦、shared outcome measures 啦、data systems 啦、collaborative systems improvement 同埋 financial and policy alignment 咯。咁仲有 additional levers for transformation 咧，我哋會有 organizational bridging 啦、governance 啦、accountability and monitoring。咁其實有啲國家真係有個 centralized planning authority on 一個 national level to consolidate service planning。譬如話佢哋有個叫 Child Health Development Agency 嘅，咁佢真係會 reorganize 翻 existing 嘅 funding streams， 因為我哋知 co-funding on convergent outcomes 就真係會 drive integration in a more evidence cost-based level 啦。咁亦都會有翻一個 centralized 嘅 oversight to aggregate 翻啲 outcome monitoring to monitor overall 嘅 child and whole person health。咁呢個就真係可以做到我哋話所謂嘅 golden thread 啦。咁 with children, families and communities at the center of sustainability and health vision of the future。咁我哋亦都想 prioritize 翻 investment in women's health and family support 啦 ，to drive overall societal development 啦。leverage 翻 cross-sector investment to advance innovation so that community networks 唔係淨係 partners but also drivers。and 始終我哋會真係需要一個 leadership consortium 啦、strategy sharing 啦、collaboration in driving policy change and 一個 genuine 嘅 legislative reform and long-term policy commitment 啦。咁所以我 sorry 呢個真係好 busy， 但係因為我諗唔到仲可以全部點樣擺埋一齊。頭先講嗰啲 from health to 所謂嘅 equity 啦、communities 咁樣，咁呢個就我諗緊一個 model 啦 framework levers for transformation。How can we monitor 我哋個 implementation and progress？ 咁呢個係我整出嚟嘅 matrix 啦。咁係好 busy。咁其實呢度係我哋嗰個 where are we at and what can we do next？ 咁譬如話 pediatric horizontal integration、vertical integration、dental、metabolic behavioral education、social welfare、green cities、healthcare。咁 evidence 就好齊㗎啦。一個 major problem 就係who would be the workforce。咁呢啲 integrated pathways and network hubs 存唔存在？ 咁譬如話 horizontal vertical longitudinal 就 in progress 啦，咁 funding centrally 有啲嘢就有啦，有啲嘢就未有啦。philanthropy 就有啲好多 commitment 已經係有人做緊啦，特別係 green cities 嗰啲啦。physical infrastructure 又冇 digital infrastructure 又冇，咁有啲嘢係 in progress 緊。咁喺 equity sustainability best practice systems resilience operability 點樣 monitor long term 呢個就真係個好大嘅問題。咁 at least very encouraging across 我哋全部想 hit 嘅 targets 咧，我哋2024年嘅 policy address 就真係有一個所謂嘅一個 policy 嘅一個commitment 啦。咁但係正如就真係要去到 legislation and governance 嘅 regulation 啦。咁 at least green cities 同 healthcare 就有，咁但係喺呢啲所謂 integration 嘅層次就應該未 formalize 嘅。咁去到呢度就係個 next step 啦。我哋可以總結翻睇翻每個 column， 其實我哋去到邊一個位，我哋係咪已經去到 consensus 嘅層次，定我哋喺 integration 個 step， 定其實我哋其實已經做得好好啦，我哋可以 scale up 啦。咁所以呢個就係一個好似一個 model for 一個 monitoring of where we are 咯。咁 what are we really missing？ 我諗就係個 maternal to postpartum early childhood integration of 個 golden thread 啦，個 well women's health 啦 ，secondary school 嘅 dental care 啦 ，preschool 嘅 vision 啦，nutrition and food security for all of 我哋 underweight 嘅 children 啦，咁 poverty alleviation 有冇啲 bundle financial support？ 我哋可以諗parenting and child care and public-private partnerships 同埋成嘅 local air pollution 都係我哋自己 emit 嘅 vehicles 同埋 container ships 有冇得再做得好啲啦？咁 transforming to a family journey life course model 其實真係講緊係 creative and opportunistic synergism 啦，可以 deliver 翻 sustainable and cost-effective long-term change。咁都係 across all the spheres of health systems management, social policy and health economics。咁我個 metaphor 因為今日講咗好多嘢，咁個 vehicle 咧其實嗰架車咧就係一個 electric vehicle 啦，喺我個腦入邊。嗰架車咧就係個 health system transformation model， 個 engine 咧就係 integration 啦，咁個 catalyst 咧同埋個 ignition 咧就係個 innovation to drive 個 systematic change 啦。咁 who is driving this vehicle？ 係咪因為個 self-driving 嘅 Tesla 冇人揸緊呢架車？咁梗係唔係啦。其實個 driver is all of us， 因為 collaborative leadership need is necessary to get us where we are going 咯。咁講到呢度，我就好快用幾分鐘講翻個 personal journey， 因為我覺得呢個 vertical horizontal 同埋 longitudinal integration， 我個自己呢個 global health fellowship 都係一個 metaphor 啦。咁睇睇呢個 longitudinal vector of time 同埋 east west， 雖然而家嗰個世界就好緊張啦，不過其實我都啱啱完成咗呢個。咁無論係 east west 或者係我哋同 Greater Bay Area， 大家都好多 lessons to be learned 嘅。咁 CH 其實係啟德嘅 runway 啦，我就唔知講師大家清唔清楚，即係1800年一開始其實係 Sir Dr. Kai-ning 啦。咁都係 UK trained 嘅 physician and barrister， 其實係佢個屋企人 own 咗嗰個啟德嘅嗰個地嘅。咁佢其實就係建立咗我哋 Hong Kong College of Medicine for Chinese 啦，1887年啦。咁 later 呢個就變咗 Hong Kong U Faculty of Medicine。咁佢個老婆係 Alice 啦，佢嘅 sister 係何妙玲啦。咁拿打素醫院就係 named after 佢兩個啦。咁佢亦都係新一身嘅 teacher 啦。咁當然佢就係我哋 Republic of China 嘅 revolutionary founder。咁嗰陣時何醫生就係話 necessary to give up my profession of healing men to take up curing the country 啦。咁佢嘅 revolution ideas 就係話 entirely in Hong Kong 啦。咁所以我諗佢都會幾開心喺啟德嗰塊地，而家就起咗一個兒童醫院啦。咁亦都係做到我哋盡量做到 multidisciplinary care 啦。咁呢個 fellowship global fellowship 都令到我可以有個 opportunity 真係 from bedside to public health and policy 就做到嗰個 vertical integration across sectors 嘅嗰樣嘢。咁亦都係 horizontal integration 咧，因為其實去到個美國嗰時啦，就認識咗唔同嘅 Professor Buta 都係 Pediatrics 嘅人。咁就其實就join 咗佢哋嗰個 climate action 嘅 collaborative。咁所以其實就多咗 horizontal integration 啦。我自己個 life journey 就多咗個 climate change 嘅一個health fellowship 啦。咁呢個都係 jointly awarded by US National Academy of Medicine 同埋 UK Academy of Sciences， 都係佢哋第一個 transatlantic 嘅 cross-sector collaborative consensus project on climate change and health equity。咁所以呢個就係我今年嘅 project 啦，咁樣啦。咁 IMP 咧，我就唔知大家應該都好清楚 ，IMP 就係 build 咗個 Louvre 嘅個 architect 啦，好出名啦，都係 Hong Kong 嘅新啦。咁所以其實嗰陣時喺 Washington DC 嘅時候，其實個 Museum of Art 都係佢設計嘅。咁你會發現 Louvre 啦，美國個 DC 嘅嗰個Museum of Art 同埋 Bank of China 都係有一樣嘅 interlocking 個 triangle 嘅 pattern。咁其實佢就講一句就係 Life is function, it really takes place in the spaces we create。咁其實佢就 inspire 咗 by 佢 grandpa 嘅 Chinese rock garden 啦，就係 living in resonance and harmony with nature。咁我哋就覺得sustainable city 好似好新，但係其實唔係嘅喎。1966年呢，其實 IMP 喺 Brooklyn 呢，即係 New York 嗰邊，其實已經設計緊呢啲traffic free zone 啦、green belts 啦、interlocking parts 就係跟佢嗰個 爺爺嘅嗰個 garden 嘅 design 咁樣去設計翻美國嘅嗰啲所謂嘅 cities 咯，咁所以嗰時佢都會 pay 翻啲 residents to plant trees 啦，咁會 train 埋佢哋有翻啲 skill development， 所以其實呢個 is not a new idea， 我哋其實係重演緊同一個 idea over and over up to this modern day 啦，咁樣啦。咁就 longitudinal integration， 咁呢個都好 happy 可以 share 翻呢個 story。其實嗰陣時去到 National Academy of Medicine 個身份係 policy 嘅一個 fellow， 但係其實就 meet 咗 Gilbert S. Omenn 啦。咁其實佢就係1965年第一個 report 咗 Omenn syndrome severe combined immune deficiency， 嗰陣時連個 SCID 嘅名我哋都唔知呢個病。咁咧而家就其實佢出現咗喺呢度，因為其實佢自己就係重視緊 invest 緊 in public health policy， 所以佢自己分緊一個 fellowship for public health 嘅。咁所以兩個曾經掂過 immunology 或者而家做緊 immunology 嘅人，又會突然間喺個 policy 嘅地方，大家約埋一齊，我又 share 咗俾佢聽。我哋其實 implement 咗 newborn screening 3年，我哋亦都 successfully transplant 咗3個 case， 就包括一個25週嘅 Omenn syndrome。咁我可以 share 翻呢個故事俾佢聽。我覺得呢個就係 longitudinal integration over time 啦。咁一個好 wonderful 嘅 story of history 啦 ，generational collaboration 啦 ，bedside to policy。咁我覺得我哋嗰個 future hope 就要 intersect 翻 public health 同埋 precision health and early cellular therapy 啦，咁樣啦。咁最後幾張就係嗰時我自己喺無國界就喺南蘇丹啦，咁其實佢有棵樹就叫 Baobab Tree 嘅，就真係會 provide shelter nutrition 成個 ecosystem communities fire resistant。咁其實都係講緊呢棵樹喺兒童醫院喺香港呢個咁特別嘅地方，其實我哋都係想幫翻 pediatric ecosystems in the whole community 嘅。咁最後都想 optimize 翻每個 child 嘅 full potential 啦 ，from disability to athletes, fashion designers, artists。其實我哋有啲關節炎嘅細路仔都可以去到有啲 rock climbing 嘅 competition， 我覺得其實都我哋真係處於一個 very lucky place and time， 我哋有咁多資源可以做好每個 patient 嘅individualized care 啦。咁所以好多謝全部啲 patients and families 啦。who are our teachers。最後我哋希望有翻即係真係sustainable changes on patients' function and quality of life for dignity, remission, growth, well-being and development。咁呢個未去到最後一張 slide 嘅，大家留一留仲有一張特別嘅。咁多謝阿 Dr. Bill Chan 啦，咁就同埋我哋咁多Hong Kong U 啊 National Academy of Medicine 同埋我自己兒童醫院啊 Hong Kong U 啊 QM 咁多年咁多同事去支持我去有呢啲機會 for exchange。咁雖然而家個 situation internationally 好 tense， 但係繼續好多 lessons from past, present to future 我哋可以學嘅。咁所以最後兩張 slide 啦，咁其實我都覺得我哋係continuum of time life connection from individual to global communities。希望今日都俾咗少少 micro to macro and back to micro 咁樣嘅所謂嘅 story sharing 同埋我個 metaphor for where we need to go。咁都好多謝咁多人去支持我喺其實我我喺新加坡嚟嘅，但係可以喺香港呢個咁特別嘅地方嘅呢個好特別嘅時間，同埋咁多特別嘅同事同埋特別嘅所謂嘅好好嘅唔同有 policy maker to frontline， 可以希望我哋一齊 create 翻同埋create 翻啲 good 嘅 health ecosystem， 可以 remain, sustain, attain, change and empower us and enrich our lives。咁呢個 challenge is an opportunity to really deliver on the promise of hope and make it a reality 咁樣啦。咁最後一張 slide 啦，咁講咗咁多嘢，其實我就 come together with 一個好 busy 嘅一個我哋叫 Pediatrics PAEDIATRIC 嘅 framework 啦。咁我哋想由 No Child Left Behind to Integration and Innovation to Every Child Striding Forward。咁就 P 啦 ，P for Partnerships, Proactiveness, Prevention, Promotion, Precision and Population Health。A for Alliance and Call to Action， 因為冇 Planet B 啦。E for Equity, Ethics, Evidence, East West, Past, Present, Future Exchange。D Deliver, Improve Lifelong Health, Holistic Wellbeing Outcomes and also life trajectories。咁 I 就 interdisciplinary 啦 multidisciplinary 啦同埋 cross-sector design。A action and assessment framework from evidence-based medicine to policy。T transformation of the health system over time, longitudinally and time to thrive。咁個 rational update 就要改翻我哋個 values 啦 ethics and vision， 因為我哋個 system design and financing is based on this。咁就 I 就 integration, innovation, implementation。C 就最長 community, co-creation, consensus, continuum, connection, climate, collaboration, convergence。and 最後S for synergy at points of intersect between the stakeholders in a sustainable manner。咁呢張 slide 就係我淨係可以咁樣先 summarize 到咁多 micro to macro。咁呢張都係 integrate 咗 horizontally 啦，你見到 vertically integrate 咗啦。咁就正如係 longitudinal integration 就靠我哋大家一齊over time 咁樣去合作啦。咁樣咧，所以多謝大家今日嚟 join 我個 talk 啦。咁都歡迎有啲任何 questions。咁我都知好 ambitious cover 咗好多嘢，不過希望 somehow 我哋都可以 put the past, present, future and east west and cross systems 嘅 thinking together from policy to transformation 咯。唔該晒 ，thank you。
好多謝 Kai。咁咧，其實咧我就佢 早一陣子已經俾咗個 PowerPoint 俾我諗住一定講唔晒，果然講得晒啊，好犀利啊！咁咧就我以往咧都坐過好多呢啲 selection board， 就 select 啲人去啲 scholarship 嗰度。咁咧就我成日都有個感覺嘅，即係揀咗人去，咁跟住咧就冇乜 return 嘅，即係唔係個人唔翻嚟啊？翻嚟之後咧好似冇咩 action 啊，又冇咩 report 啊，又唔知發生咗咩事啊咁樣。咁咧就阿 Kai 今次咧就我諗就好唔同啊，令我好改觀，因為其實佢唔係去好耐嘅，咁佢去Washington DC 去咗6個禮拜6個禮拜。咁仲係好艱難嗰段時間去啦，即係中美嗰個關係開始緊張嗰陣時去。咁咧就，但係咧佢都做咗咁多嘢翻出嚟。咁嗱，呢個係一個好好嘅 report 啦。咁跟住你會點做咧？即係我估你唔係想淨係做個 report 出嚟啦，你都希望即係會去到有啲 action 出嚟，或者 outcome 出嚟。你好似做咗個 roadmap 出嚟啦。咁你下一步、再下一步、再下一步、再下一步，即係會點樣做咧？
多謝陳醫生。咁就我諗呢個就係因為 stock taking， 你話其實我哋嗰陣時就係話譬如話喺美國嗰陣時嗰個 launching lifelong transformation， 咁嗰陣時佢哋就 stock take 我哋有咩 existing literature of 而家嗰個 health system， 但係其實 actually for 香港，雖然我哋話有 health census data， 但係冇乜人形容過一個咁樣嘅 snapshot of 個 overview of all the health systems specifically for pediatrics。咁我覺得 bringing pediatrics to the forefront 其實係一個 first step 啦，就變咗係我哋要 highlight 翻其實 pediatrician 同埋family medicine practitioner 真係 first touch， 我哋亦都係應該係帶動個 momentum to integrate 翻我哋 focus 翻呢個 golden thread 嘅呢樣嘢。咁所以 one is to raise awareness about 呢件事啦，即係當我哋講緊 health system transformation 就唔係 independently pediatrics 同大人分開 integrate，就真係講緊 putting lifelong approach or life journey model at the forefront 係嗰個 part of 個 conversation 先。咁同埋我諗 getting the information out there so that 我哋可以 over time sort of我哋大家要認同翻呢個改觀 of 我哋點樣 invest in healthcare， 我哋點樣去做。咁所以最近我都有翻咗嚟之後，我都有 link up with 唔同嘅團隊啦，或者唔同嘅機構啦，喺唔同層次嗰陣時都randomly invite 咗 join 咗一個 AI 嘅一個 seminar 或者 AI tech in Hong Kong。咁嗰陣時都係有 present 咗 from 一個 health perspective， 咁又 reach out 咗 cross sector 嘅 collaboration， 咁都有啲係講下一步嘅 investment 其實我哋應該要點樣做。咁我諗有 steps within 個 system 啦 ，within 個 healthcare system， 好似今次呢個 talk 都係想 raise awareness from 同sector 嘅同事啦。咁 next step 就係我哋講緊嗰個 action， 所以 how to get a consensus 啦。咁 either within 個 system 我哋可以有 lobbying， 我哋有 health promotion， 我哋有所謂嘅去到 policy maker 嘅 level， 我哋點樣 engage 佢哋。但係同一時間 parallel， 其實 outside 個 system 都好多人做緊好多嘢，但係好 siloed， 係 independent。我哋要 somehow link up 呢啲 alliances between 啲 NGO 啊，唔同 sector 嘅同事啊。咁其實就真係個 consensus building 嘅時候，我哋真係好做，都未去到個 consensus building 嘅 statement， 因為個 stakeholders 係邊個，我覺得大家都唔係好清楚，同埋有啲 overlap 嘅。當你睇翻大家做緊嘅嘢，其實係可能係 duplicate 咗啲 funding in certain siloed areas 咁樣。咁所以當然我一個人做嘅嘢就好有限啦，我都需要大家去 collaborate 翻呢樣嘢。不過我覺得我 raise up 咗呢樣嘢 as 個 first step， 我自己可以做嘅就係去 disseminate 翻呢個 information 先，and see it somehow 我哋 reach more of the policy makers and also partners，and then我覺得個 next step 都係講緊點樣去 implement 翻我哋諗緊嘅 model 咧。但係當然 within 個 bigger wider ecosystem， 大家幾認同呢啲嘢係 integrated， 亦都係重要嘅，就真係要時間啦。我覺得。
其實我諗你揀啱咗啲方法去做，即係第一就上嚟呢度講啦，第二就即係我諗你 join 咗啲 tech group， 其實都好緊要嘅，即係而家香港都係着重啲 innovation， 國家都係着重啲 innovation。咁頭先你講 stakeholder 咧，我估 stakeholder 最重要嘅就係父母。咁要佢哋認同咧，你入邊講你先至會落實到。咁跟住佢認同咗之後咧，其實就有啲方法。咁咧而家 technology 咧就係嗰個方法嚟嘅，即係你變咗即係我哋譬如而家講緊好多 app 啊，好多令個父母其實 more aware of 自己嘅細路仔嗰個 health status 喺邊度，因為佢真係唔知嘅，其實好多時。咁但係即係啲 technology 嘅就會幫到我哋，咁所以呢個都係重要。 咁第三個 stakeholder 當然就係我哋自己啲醫生、護士嗰啲啦。咁我成日都係，因為我自己都有演魔費教書啦。咁你會點樣去將你自己信呢個 framework 咧？去灌輸俾下一代，或者啲不定嘅 pediatrician 啊、family physician 啊、nurses 啊咁樣。我哋好多 nurses 聽嘅今日。咁你會點樣將你呢個理念咧，即係令到佢哋buy in 咧？
多謝陳醫生，係啦，其實都幾得意，因為 join 咗個 climate change 嘅嗰個 fellowship 都見到其實譬如話 NHS 啦，或者係美國唔同嘅 sector， 其實佢哋做緊啲咩咧？即係譬如話喺嗰個 licensing 啊，或者 medical education，佢哋已經係一個 very core part 啦，即係 sustainability in healthcare and health research 已經係某一啲大學已經變咗係 part of 個 compulsory curriculum 啦。咁亦都係嗰個 licensing， 即係 professional 嘅層次，譬如話我想畢業 from fellowship of Pediatrics， 我真係可能有個 module 係 complete 咗，係 specifically on sustainability in healthcare 啊，或者 integrating healthcare 呢樣嘢，咁所以NHS 亦都係真係有個 commitment 係一個咁，好似陳醫生之前講，咁你做開就應該要做㗎啦，咁就變咗係嗰個day to day 已經係個 daily practice of 個 hospital， 佢哋已經有啲 decarbonisation 嘅 steps 係已經 doing 緊啦。咁呢啲就講緊真係講緊 raising awareness of greener communities。咁呢個係一個 step， 不過點樣去即係我覺得呢個都好嘅，即係 bringing hospital into 嗰個 home 啦，as you said，即係將 apps 嘅層次，將 health and health awareness bringing into 大家嘅 daily lives， 或者 making it a routine part of life to 去跑步啊，喺 green areas 啊，大家做翻 waste recycling， 同一時間將嗰個 community 又帶翻入去間醫院，就係原來我哋喺醫院入邊其實都有 sustainability 嘅 targets 應該要 meet。咁我諗係嗰個 making it a part of everyone's routine life in a very accessible way， 亦都係大家接受到，亦都係其實慣性咗大家做開。咁我覺得呢個就自然的個 community 個感覺係會 link up 咗多少少咯。
咁咧就不如答咗網上一個題目先。咁Emily 我 number one fans 啊。咁咧佢話 Thank you so much for all the highly informative and forward thinking。咁所以就話基層醫療處就開咗首間嘅樂研集。Can you elaborate a bit more on this new initiative on women's health from Primary Health Bureau in the coming few years？
咁就變咗係可能Primary Health Bureau 嘅 New Initiative Women Health， 我就可能要再 look up 多少少 information， 因為好多primary care 嗰啲咧就變咗我都知有啲係 changing in flux 咁樣咧，咁所以呢個我要再 look up 多少少。不過我就見到佢哋有提到，即係 as in from 我可以 access 到嘅 documents， 或者我有同事嘅啲 conversation， 就真係話佢哋有個 plan to integrate 實實在在嗰個 details， 譬如話係 DH 啊，或者係 Family Medical Planning Association， 再加埋同 NGO 嘅合作咧，嗰邊就真係要多少少 information 啦，嗰個就未係好清晰嘅，我覺得。
其實 Emily 講咗一個好重要嘅 stakeholder， 呢個慢病共治計劃咧，而家講緊即係糖尿啦、血壓高啦嚇，同埋嗰啲即係cholesterol 啊、hyperlipidemia。其實好多時咧，我哋發覺都係喺細路仔開始嘅。咁其實我真係希望阿彭非洲醫生即係有機會聽到呢個節目咧，佢都諗下，即係其實即係與其我哋喺中年或者即係年長嗰啲，我哋開始，不如就再早啲開始。咁當然即係有人 argue 咗，喂，錢從何來啊？其實咧，頭先你講咗一樣咧，就係個 health insurance 嘅 coverage。都係偏低嘅嗬，其實
係咯，即係有50%嘅香港人其實冇 health insurance 啦 ，and then within that 其實有啲科又係 disproportionate， 即係個 dental 真係原來係全港係得20% 嘅人係有任何 dental coverage from private 咯。
嗱，我哋知道即係政府就用咗個 voluntary health insurance scheme 啦，
但係嗰個都係最後大家都係冇包底嘅咁樣。係
啦，咁但係已經係我諗向前行咗一大步，我諗就值得其實繼續講得快啲嚇，因為政府其實點解推呢個 scheme 都係唔想話 overload 咗 HA 啊 ，overload 咗 public health system。咁但係叫人 buy in 先得，即係其實我成日都叫我 even 我叫啲醫學生買保險，你快啲買保險啊，因為後生買着數啲啦。咁跟住呢個 voluntary health insurance scheme 嘅細路仔就仲好啲啦嘛嚇。咁所以呢個都係一個方法。所以其實呢個 illustrate 咗幾樣嘢，但係咧你而家有一個咁宏觀嘅 framework 咧，其實就好多嘢一定要開始喐嘅。即係譬如我頭先講咗少少，即係咁你 funding 喺邊度嚟？咁一係 insurance 啦嚇，跟住你點樣去 screening？咁個慢病共治其實好嘅，我覺得即係不過。 可唔可以早啲拱落去啲細路仔嗰度？因為嗰度真係預防啊嘛。咁第三樣咧就去到即係啲家長啊嚇，如果有 AI 啊，有啲 app 啊，咁又可以推得快啲。嗱，仲有一個咧，我覺得好困難，睇下你點樣睇法。學校咧就即係其實佔個細路仔嘅時間都好多。咁點樣學校拱到你呢個 framework 咧？其實
我覺得佢哋而家現有嗰個即係啲已經有個認同係要 involve 佢哋啦，即係你個所謂咩 healthy school 啊 whole health school 個mental 3 tier 嘅咩 program 咁樣，咁我覺得嗰個 as you said 其實細路仔最多時間都係學校嘅啫，咁所以我覺得嗰個 framework if it is working well， 我哋亦都覺得佢真係會 yield 到第一大家個 overall mental health well-being， 佢哋即係學生自己評估自己啦，老師自己評估自己啦，再加埋佢哋個 self-rated 嘅 mental health 係 improve 咗 pre and post 嗰個 introduction of 呢啲 intervention， 再加埋真係需要得到個 attention 嗰啲細路仔又真係有得到喎，咁我哋覺得呢個 program 係 worthwhile 嘅話，其實我覺得呢個係咪應該落行我哋全部學校都要 run 呢？即係 this is a basic component of 即係 self-care 咯，係咪？咁所以變咗係if 你話 mental health awareness 啊，即係好簡單。譬如有時我哋去到 clinic 嘅時候喺門診，都唔係講緊個 medical issue， 係講緊喂你個 stress coping strategy 得唔得㗎？咁樣其實有啲係真係 within life community 嘅環節入邊，學校真係可以 play 個 big role。which 你唔使一定話一定要一個school counselor、education counselor， 其實你有啲甚至學老師啊，或者係 student 自己啦，佢哋自己變咗 mental health ambassador， 有啲學校都有佢哋 take up 咗個 role， 我係 promoting mental health 嘅嗰個 ambassador， 有個學生自己有個 initiative 去 empower 翻啲 student take up 個 role， 佢哋去 promote 翻 healthy exercise， 佢哋去 promote 翻 education， 其實都幾得意，因為之前我有啲 collaboration 係同某啲ESF 或者 international school， 因為有啲 parents of 某啲細路仔 with leukemia， 咁佢哋都好踴躍想要 blood drive， 哇！咁嗰啲真係 student driven 嘅喎，係每一年佢哋係 student drive， 佢哋好踴躍去 promote 啦，我哋就純粹幫手，我入嚟講堂書嘅 blood donation， 同 Red Cross 一齊合作，佢哋就提供架車嘅啫。但係其實啲 student themselves 其實係應該個 drivers of their own future。咁我覺得呢個就係 younger generation， 我哋要俾咗 tools 俾佢哋，俾佢哋空間，俾佢哋 empower 翻佢哋去 take ownership of 佢哋自己個 health 同埋佢哋個 future 咯。
你講得好好啊！即係有陣時我哋諗學校諗校長啦、老師啦、social worker 啦，你而家講啲高年班學生，其實呢個都係好重要嘅 resources 嚟喎，即係好重要嘅 stakeholder， 佢哋 take care 自己喎，真係。有
間 ESF 就基本上由嗰個 patient 個 sibling 佢做咗個 blood donation drive 啦，喂，直情捉埋成個 discovery bay， 全部啲 community 嘅人嚟 sign up 埋做埋 blood donation， 之餘仲要 sign up 埋個 bone marrow donor registry， 我哋都特登講咗 bone marrow donor 一堂書，咁佢真係可以招攬到全部成個 discovery bay 嘅好多唔同層次嘅人，咁都真係好好咯咁樣。
嗱，咁咧最後一個問題，我想問你，你去 Washington DC 啦 ，Washington DC 我估啲叫 capital of the lobbyist， 好多人都係做 lobbying 嘅工作。咁有冇學到幾招翻嚟？你將來可以 lobby 下我哋啲 policy maker 啊咁樣樣咧？
佢哋好得意嘅地方就係美國個 system 同我哋除咗 system 嘅問題，即係佢個 population 啦，佢個 demographics 都好唔同嘅。咁譬如話，佢哋會多，你會見到係個 consensus process， 佢哋點樣 bring together 咁多唔同嘅人去 acknowledge 到佢有個 voice， 佢係坐喺個 table， 佢係有 contribution。但係同一時間呢，嗰個 process 亦都會好慢，因為其實佢係唔夠 homogeneous， 佢唔可以有個 unified，其實係冇可能有個 unified vision， 因為佢個 country 嘅 design 就係 melting pot， 咁你永遠冇 homogeneity 嘅時候，你好難有一個 unified response 嘅。咁調翻轉就令到我好 grateful 香港其實 to some extent 我哋個 population more homogeneous 啦，大家嘅 values 或者 work ethic 可能都差唔多。咁所以調翻轉我哋要諗一諗點樣係香港一個細啲 dense 啲嘅地方，我哋冇 geographical 嘅 huge distance，其實我哋點樣可以做得好咯？其實所以呢個就去翻之前陳醫生你今朝即係一開始講嘅時候就係點樣做得精準。其實我哋係細，但係我哋可以做得非常之好咯。我諗呢個都係平時同即係有時翻北京啊或者其他啲地方個 exchange， 大家都會話 OK， 你唔係好多 case， 但係你真係做得好好。我覺得我哋要香港要行呢條路線。上次喺嗰個 AI 個 tech 嘅會我都係咁樣講嘅，即係我哋個 volume 係冇得爭噶啦，不過我哋可以做得精準。咁我覺得呢個 cross sector 大家個諗法都係認同嘅。咁 if 大家個 goals 同埋個 processes 同埋個 systems 嘅 direction 都一樣，咁我諗呢個 horizontal integration 就真係會可以容易少少。
其實你頭先講咗另外一個字叫 consensus， 你 emphasize 咗好多次。咁咧 consensus 咧就 唔係寫出嚟嘅 consensus 係傾出嚟嘅。
係。
咁就我其實就有啲觀眾都成日聽我講，我就好希望咧我而家就退下火線啦，我就希望即係啲 frontline 同事或者醫院組同事多啲傾偈嚇。即係我知好多 challenges 啊，最近有好多轉變，但係咧就如果大家睇耐啲，發覺好多嘢都係碌翻轉頭嘅啫，好多嘢。咁其實最lasting 咧就反為大家啲 friendship， 大家 relationship。咁嗰啲咧就要大家傾偈傾出嚟。咁可唔可以即係譬如話用即係我哋頭先呢啲話題，或者啲病或者啲病人嘅 care 係一個 common 嘅話題，大家傾多啲偈。咁所以就希望由傾偈嗰度咧就得出頭先你講嗰個 consensus 嚇。咁有 consensus 咧就 lobby 就好簡單，因為咧你政府都同意啦。譬如上一個 talk 咁樣講 mandatory reporting。Bureau 嘅同事都話咁你哋其實已經即係有晒共識啦，咁我哋做就好容易啦咁樣。咁呢個係嘅，真係最怕咧就係當年我做 COC chairman 嗰時，佢話你傾掂至講啦，你咁多個 cluster， 你傾掂至同我講啦咁樣。咁所以咧就花咗好多時間喺度。咁我真係好希望，咁下一個世界就係你哋㗎啦，即係Kai。咁我希望即係你哋呢個 generation 可以傾多啲偈嚇，咁從而咧就有個consensus 變咗你喺今次喺呢個 scholarship 喺個 fellowship 得出嚟嘅 framework 咧就可以更加之refine， 同埋最緊要落到地嚇，即係最緊要落到地講咧就好多人都講到，但係最緊要落到地。咁我都深信即係會落到地嘅嚇。咁但係就要即係 involve the next generation 啊，啲學生啊。有 involve 即係 horizontal 好多 groups 啊咁樣。咁今日咧好多謝阿 Kai 上嚟。咁咧就我台面有個紀念品。
多謝呢個。
係啊，以而為先。咁咧就我又唔係識阿 Kai 好耐啦，不過就佢 impress 好 impress 我嘅嚇，即係佢諗嘢好闊啊咁樣，咁同埋好 dedicated 嘅。咁我希望即係嚟緊你再上嚟講啦，下次可能講翻你老本行啦，啲 rheumatology 嘅嘢啦嚇。咁雖然我知道你好多話題都可以講嚇，咁今日好多謝你上嚟俾呢個 talk， 我覺得係好 inspiring 嘅。我特登叫啲 medical student 嚟聽嘅今日呢個。
好。